And whether it was the doubles vendor, the pie man, whatever, they can all start back plying their trade with the exception of in-store dining, and that all these activities will cease at 8 p.m. in the night. That was our first tentative baby steps towards reopening of the economy. We did say at the Saturday's press conference at the Diplomatic Center when we announced that if things go well, if the numbers look well, we may advance phases 2, 3, and 4 as deemed fit by the opinions of the public health officials. It was announced by the Honorable Prime Minister again on Saturday gone that the numbers looked well, and as a result, we have advanced certain phases. The 2 phases we have advanced are construction, whether it's public construction or private construction, and manufacturing. So we have brought that forward from next week, Monday, and we have brought it forward by 4 days. These steps announced, which began on Monday 11th and will begin tomorrow. So we are on the eve of the advancement of certain parts of phase 2, are 2 massive but scary steps. Big steps, but scary, as we head towards increased economic activity. But with economic activity is going to come the inevitable increased movement of people. And that is what is scary. Because with the movement of people, you are now going to have increased opportunities for spread. Spread of everything, from the common cold, H1N1, for which you could be vaccinated against, the bug that causes gastroenteritis, vomiting, diarrhea, and COVID. So all these bugs, all these viruses will now be moving around with people, and therefore the risk of transmission from person to person becomes an issue. Based on that, it is critical, it is absolutely critical that we adhere to the public health measures which we have been putting out. A lot of the onus for the non-transmission of these viruses now rests, as I said on Monday, with Mr. and Mrs. Trinidadian and Mr. and Mrs. Tobagonian. The populations and the individuals' response to hand washing, physical distancing, staying home if you are ill, and the wearing of masks become absolutely critical in this fight. And I want to thank, I heard part of the discussion this morning on 95.5 with Dale and Tony, and I want to thank them for raising the issue of masks. Because in my travels around the north of the country, yes, people are wearing masks. But you know what they are doing, Minister Cox? They have on the masks, but then they do that. And you see them standing in the streets with their mask on. You can't blame them, they have the masks. But they are talking to people, and they are being spoken to, and the mask is on the chin. As Dr. Hines would have said in one of his previous appearances here, having the mask on your chin is not going to help. I remember seeing him having the mask on your forehead is not going to help. Having the mask in your pocket is not going to help. Have a mask, yes, but have a mask and wear it and cover your nose and mouth. This is public response number 1. Your mask must cover your nose and mouth. If you have it here, you might as well not have a mask. And I will take Dale and Tony's advice and bring back maybe Dr. Hines or Nurse Gomez to speak about the proper wearing of a mask. The last point I want to make before I hand over is that even though we are opening up certain parts of the economy, you still have a duty to stay home if you don't need to be outside. If you don't need to go to work, stay home. Because If you have an elderly person living at home with you and you go out a line, you go to a COVID party as a young, healthy adult, you would bring the virus home into your home setting and place your parents, your grandparents, your tanties, your uncles, your nenen, your aji, your aja, your pua, whatever you call them, depending on your culture. You would put those elderly persons at risk. So all 6 public health measures we are advising become important. This now is your personal contribution to the fight against COVID. The public's contribution is hand hygiene, physical distancing, don't touch your face, because you see people again, Minister Cox, with the masks on, and they keep on doing that. The mask is only as effective as keeping your hands in your pocket. So please, the simple public health measures will distinguish us as a country. So your personal contribution, citizens of Trinidad and Tobago, will cost you nothing. You can make your own mask at home. We will bring somebody to show you how to make a mask at home. Don't wait for the government to give you a mask. You don't have to pay $50 for a mask or $100 for a designer mask. If you can, fine. But your personal contribution today moving forward, my dear citizens, brothers and sisters of Trinidad and Tobago, wear a mask, hand hygiene, physical distances, and stay home if you are ill, so that we do not add to the global figures of 322,000 deaths. We do not add to the global figures of over 5 million cases globally. So that's my simple message for this morning. And Minister Cox, I thank you for the opportunity.
Thank you very much, Minister. Simple but very important message. The Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Good morning, Honorable Ministers, members of the media, members of the viewing and listening public. The update for Wednesday, the 20th of May, 2020 is as follows. Samples submitted to CAFA and the UE site, 2,774. Number of repeated tests, 412. Number of unique patients tests completed, 2,362. Number of positives remain at 116. Community tests completed thus far, 1,047. All of which are negative. 107 persons discharged thus far, 8 deaths, 7 in Trinidad, 1 in Tobago. Cora houses the sole patient. 1 patient at Cora is in very stable condition. In terms of the other facilities that we have, at the Napa, we have 20 healthcare workers housed. Cascadia Hotel, there are 3 persons. And at the Tacarigua facility, there are 21 persons, giving us a total of 44 persons in the parallel system. Thank you, Minister Cox.
Thank you very much, Dr. Parasram. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the poll and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. Priya Bihari.
Hi, good morning, Priya Bihari, AZPnews.com.
Good morning.
I want to take you all to the guidelines that is published in the Ministry of Health about reopening. Number 7, part 7 of that guideline states that individual establishment must submit tailored plans to the CMOHs. Can you just explain that? Is it that every establishment from the sole trader to the big business must submit these plans before they reopen? That's my question.
So no, it's not a mandatory submission. What we're speaking of, so we have the guidelines. So out of guidelines, every business place is expected to have their own protocols. Whether you're a small business place or a large business place, doesn't matter. You have to have protocols in terms of social distancing, in terms of hand washing facilities, how we sanitize, the process and the procedures for sanitizing. So it doesn't have to be submitted to as a mandatory act before you open. But you can submit it to the office of the CMOH, who would be the county representative for public health, who will now look at your plan, send a public health inspector out to visit your institution, work along with you to ensure that the plans are robust and that the risk is low in your business place. So that's the process to follow. As I said, it is a guideline. It gives guidelines as to what are the best practices, but protocols come out of the guidelines for the individual institutions.
Thank you very much. 98.1.
And a very good morning to the head table, Stephen Cummings, 98.1 FM. Two questions, those questions for Minister Dayal Singh. Minister, how often does Trinidad and Tobago report to its reporting mechanism to the World Health Organization? How often is that done? Is it per COVID case, per week, per month? And who comprises our local reporting validation team? And the second question, I had a follow-on question that I wanted on the last occasion. I didn't have the opportunity to do so. And as we wait on the PT panel results this week, is there or should there be a policy to have the names of those labs approved for testing, published or gazetted, so the public will know of their validity or approved certification status?
Okay, so I will give you the strategic view of both, and then the CMO will give you details. We have said publicly on this forum many times that any private lab that fits the criteria set out under the guidance of the Chief Medical Officer, PAHO and CARFA, they will be made public. To date, I am not aware, and the CMO can elaborate, no private lab, as we speak now, has gone through the process. The only lab outside of CARFA that went through the process and successfully completed the process is the virology lab at UE. They had to undergo the same process that we are asking private labs to undergo. As far as your first question, the Minister of Health does not have a reporting function on statistics to WHO. The local focal point for reporting to WHO is the Chief Medical Officer. It is free from my management, my control, and the Chief Medical Officer, who is the focal point, could expand on your question. Thank you.
Okay, so I am the International Health Regulation focal point for Trinidad and Tobago for reporting to PAHO WHO. We report to PAHO, and then that goes up to WHO. If an event occurs, which is a public health event of international concern, and there are a number of criteria that have to be met for that to occur, we have 48 hours within which to report to PAHO. So that's our time frame for reporting. So for instance, when we would have had the first case of COVID, we would have had 48 hours from that first case to report. Actually, when we do any restriction in travel or trade as well, we have to report that to PAHO and WHO. So we would have done that on many occasions, and we also have to state our reasons for doing so, which we would have done starting with China. So it is our reporting mechanism. As the cases continue, we report. If you notice on the WHO website, we'll be listed as sporadic from time to time. If we get more cases as it goes, we will report that within the 48-hour time frame to PAHO. We also do an addendum which suggests to them, and they can make an analysis of, so that they can determine sporadic, community, whatever else may come. In terms of your testing, as we said before, there were originally three labs out of the 5 that were assessed that were deemed satisfactory to proceed to the testing component of it. One of the 3 have now been placed in a position where they cannot accept the PT panel as yet. So we're giving them a couple of weeks to get everything in order before we can send it to them. The other 2 persons have received their panel, and I am awaiting a formal report from CARFA as to how they have performed on those tests. So as soon as those become available, we will review it at the Ministry of Health.
Thank you very much. Newsday.
Hi, good morning, all. Superville from the Newsday paper here. I have 2 quick questions, both for the CMO. I don't know if the minister would care to chime in on either one of them.
We will see.
The first one has to... Yeah, you hear me?
Yeah.
Yes, we're hearing you.
Okay. Yeah, the 2 quick questions for the CMO. I don't know if the minister would care to chime in on either one of them. The first one has to do with any lingering symptoms among people who would have recovered from the coronavirus, and that, well, whether any of that has been noticed in TNT thus far. And that sort of funnels into the second question, which is the issue of strokes among people below the age of 50. I know the New England Journal of Medicine would have published a report in April reporting several cases of that in New York. I don't know if we would have recorded any such cases locally.
Okay, so I will come in on the policy part, and then the CMO will go into the clinical part. I remember distinctly about 3 weeks ago raising the issue of why persons should stay home. And I did alert the national community as the COVID crisis pandemic spreads its wings globally. Different populations, because of a variety of factors, could be race, geography, whatever, you are going to get different manifestations of the disease. I myself on this forum about 3 weeks ago raised the issue, and then Dr. West came in and spoke about it, about the incidence abroad of young persons in their 20s, 30s, and 40s getting strokes. So we are not unaware of it. We raised it here, and we are on the lookout for it. I even raised the issue of children presenting what is then called COVID toes and COVID fingers, which is now being linked or being paralleled with Kawasaki disease. So yes, the symptomology of this disease, as it moves through the world in different populations, it becomes vitally important not to raise the victory flag. And that is why I say the best way to overcome these things is to stay home. If you don't have to be out there, stay home. And finally, from a policy perspective, it was announced that we will be doing a total review of the 116, because 8 persons died, unfortunately, 108 cases who are still with us, to do exactly this. Find out now how their symptoms are progressing, have they fully recovered, because there's no magic number of days or weeks. So now the CMO can go into more clinical details.
So in terms of the first question with lingering symptoms, so as you know, post-discharge, so we have a very rigorous discharge criteria which we followed for all the cases that were discharged. Post-discharge, 7 days after discharge, the CMH would have been following up each case for 7 days every day, finding out if they had any further symptoms, that sort of thing. They continued that follow-up up to last week. I asked them to do a check on all the cases that would have been discharged, and they did so. They got onto most of them, and none of them, barring one person, would have actually had any symptoms. There was one person that developed symptoms. Post, they were brought in and rechecked just to make sure everything was fine, and then that person was let back home. So out of the total number of patients that were discharged as far 107, there was one person that developed some symptomatology thereafter, which was a slight cough a couple of weeks after being discharged, and then was checked to make sure everything was okay, and she was discharged back home as well. So out of that's in terms of your first question. In terms of your second question with regards to strokes, so as Minister would have alluded to, there's a number of new presentations that we are seeing, strokes being CVAs in the younger person being one of them, cardiovascular events on the whole, thrombotic phenomenon going back to the childhood, and Kawasaki's disease. So we have been on the lookout for those unusual presentations, if you want to call them, in the health system. We have actually tested some of the people that have presented with strokes, some of those that may have presented with myocardial infarctions as well as some children that would have presented with some sort of thrombotic phenomenon. So far we remain negative, but we remain on the high alert for unusual presentations of disease.
Thank you very much. Before I call the next person, who is Candice Jackson from Tobago Channel 5, on behalf of the team, we want to wish you a happy birthday in advance. We understand your birthday is on Friday. So we now call Tobago Channel 5.
She doesn't look a day over 14.
Good morning, and thank you so much. I really appreciate it.
Morning, Candice. Happy birthday to you.
Thank you. All right, so I have two questions. I am not too sure if they will be answered, but I still need to ask them anyways.
Sure.
It's been, as far as we know, no person in Tobago has been able to receive the salary grants and so on as yet. And I know a decision was taken just a few days ago that the THA would handle the processing of it because there were some problems in processing the documents. Now, I want to know, why did it take so long for the government to come to a decision to let the THA handle at least the processing of the forms and whatnot to be able to give people the grants? Because, I mean, we're having lots of problems, lots of reports of people, you know, being kicked out of their apartments and so on because, you know, they're not able to come up with the money to pay the rent for the obvious reasons. Now, my other question has to do with the tourism industry in a bit. I know that $50 million was given to the THA for supplement the tourism industry, but this only covers hoteliers. It does not cover the dive shop owners, the tour guides, and all the other businesses that are associated with tourism. And owing the fact that these businesses, the tourism-based businesses, would not be able to come on stream, would not be able to make any money, even after the economy is open up for a while because of, you know, what's going to be happening with international travel and so on. Is there additional funding going to come for these persons?
Okay, I wanted to answer your first because I have a response from the Ministry of Finance. They have received 1,063 applications for the salary relief grant via TT Post from Tobago, 1,027 from Scarborough, 36 from Roxborough. A number of online applications have also been received, but they do not track the applications or payments by geography. But now that that question is asked, they will determine how much or how many were paid since. We don't have the information, but I can just tell you that I will try to get that information as soon as possible because they now have to check based on geography to be able to provide that information. Minister, what was the second?
On the tourism industry and the grants.
I would not be able to answer that question, but I will pass it on to the Minister of Tourism and try to get back to you as soon as possible. I-95.5.
Thank you very much. Good morning to everyone. Whitfield Turner from I-95.5.
Morning, my friend.
Minister Alleyne, I'll start with you. Since the closure of the bars and the early goings, I don't know if you have seen any indication of a change in the levels of alcohol consumption and how that would likely play out in terms of the impact on the health sector going forward. And for the CMO, since the new outbreak of coronavirus in China, I'm seeing reports now which seem to indicate a possible change in the behavior of the virus, in that it's now taking in excess of 14 days for persons to present with symptoms. What impact is this development likely to have on any advice you may give to the authorities going forward, especially as it pertains to the reopening of borders when the time comes?
Okay, so I'll take your first very difficult question, Mr. Turner. As Minister of Health, I will have no information on the patterns of alcohol consumption since we started the lockdown, but anecdotally, I would like to think that people are drinking less, which is always a good thing for the Minister of Health.
Right, so in terms of your virus changing patterns, any virus can actually mutate. So they go through different phases. There could be a small mutation, which is an antigenic drift, or there could be a large mutation, which is a shift, which creates different subtypes. So I don't know if it has been categorized already in China as to what is going on. So I think the research has to come before we can make draw any conclusions on what is happening there in terms of the incubation period. But the WHO is holding fast that the majority of cases have an incubation period of 14 days, of course, with exception. So we have to use the evidence that is before us and draw conclusions from that for now. But of course, we'll be keeping a close eye on what is happening, not only in China, but in other parts of the world, as new information comes forth on the behavior of the virus.
Thank you. Sunil Lala.
Hi, good morning. Sunil Lala, Caribbean Lifestyle Communications. To Minister Alleyne.
Yes, sir.
addressed it yet, but the Cuban nurses, have they been deployed into the system just yet? And without revealing too much information, can you tell us how their compensation packages compare to local ICU nurses? And secondly, to the CMO, we've seen in other countries, officials are actually going house to house to test persons somewhat in a proactive manner. Now, I know you said persons coming into the health centers are very low, and the situation here is not that bad, but does the ministry intend to do this type of proactive testing in the near future?
Okay, so let me take the first question. As Minister of Health, I do not get involved in the deployment of individual nurses, individual doctors. There are 17,000 RHA workers. The Minister of Health has no business, has no time to deploy staff. That is left up to the RHAs, okay? On compensation package, if that question is not properly contextualized, it can lead to a lot of confusion. Any citizen contracted to work abroad via government-to-government agreement or private, like a BP or whatever, those people leaving their home country, leaving their families, are always paid a dislocation allowance. Always. Depending on the nature of the contracts, they may get free travel to come back and forth and other allowances that helps mitigate the inconvenience of leaving your home country to go and work in another country. You may have to pay rent. You may have to do this. You may have to do that. So with the Cuban nurses, that has always been the practice, not only for these 12. I hope the answer is contextualized from the perspective that it is not a disadvantage local nurses, because that is where the conversation will go. If you as a journalist was sent abroad to work by your company, you will get some type of allowance to compensate you for leaving your home country and going to another country to work. It is standard practice around the world. Thank you very much.
Thank you. CMO?
Yeah, so in terms of having a house-to-house testing regime, I don't think that was ever done in Trinidad and Tobago before. What I saw in the region happening is that in one particular country, persons were actually sending out volunteers to houses to knock on doors and ask people if they had symptoms. Now, I think what we are trying to do is to get our population as widely, the knowledge to the population as quickly as we can, so that people know what the signs and symptoms are, and we are encouraging them to seek care. So not only coming to a health center and having the hotline available to them so that they can call in. Basically, we're trying to use persuasion as best as we can to get persons to come in. I don't think we're going to use the knocking on every door sort of approach that is happening in other parts of the region. We have about 400,000 houses in Trinidad, which is based on the last CSO census, I believe. It's quite a large number of houses, but all through all diseases, Zika, chikungunya, whatever, dengue fever, we have never used the approach to go to a household and offer testing. So because of the numbers being so low in Trinidad at this point, I don't think it's something that we need to look at. But what we need to focus on is public education to ensure that everyone in those 400,000 households know what the signs and symptoms are, what are the detrimental effects of COVID, and how they can seek care if they need to.
Plus, from a policy perspective, you see what is happening. We are looking at other countries and seeing we should follow everything they are doing. We also use the GIS system, right, which is technology which replaces the need for on-the-ground manual labor. So let's be careful when we look at the news and try to import everything that every country is doing and say we should do it here. Let me give you an example. Week before last or last week, I was asked on this thing that Wuhan is now testing 11 million people, and am I going to do the same thing here? And I said at the time, it is not practical. 2 days later, Wuhan, China came out and said, they are no longer testing 11 million people. They will not be testing in communities where there are no active cases. So that dropped off a few million people already. And then they said, their first round of testing is going to be with the elderly. So even they saw it was futile to test 11 million people in one fell swoop. Trinidad and Tobago continues to look at all the practices around the world, and we will adopt and adapt where necessary, but not everything that every country does is applicable to our local circumstance. And just to support the CMO, we are using our GIS system technology to very good effect with tracing and so on. Thank you.
Thank you. 91.9.
Hi, good morning, Minister. Good morning, panel.
Morning.
Good morning.
I vote next for 91.9 FM. I just touched my face. All right. So
you like me?
Yeah, I want to just go back to a question that I asked at an earlier press conference with respect to the conversations that we will now probably be having about opening the borders internationally. And I wanted to get from a medical perspective, what kind of advice and recommendations would the Ministry of Health, the CMO, and the medical team really give in terms of opening the borders, especially where it's concerned when we look at countries who are having spikes continuously? Is it that you will make a recommendation or could make a recommendation that we do not let people from countries that are having spikes or unstable treatment of the COVID-19 response back or access into Trinidad and Tobago when we talk about reopening the borders?
Yeah, so this question was addressed about 2 to 3 weeks ago, and it's a good question. It's a good, so never apologize for asking the same question. I'll tell you why. Different people tune in on different days. So we are always reaching a new audience. So never apologize for asking the same question. We are happy to answer it. The decision on borders is going to be, the opening of the borders, as we indicated, is going to be one of the last phases, one of the very last. That comes in at phase 6. What we are focusing now is our own internal arrangements. The CMO did say, and he will repeat it, we will have to decide the countries that we want to allow persons to come back from. What are their epidemiology now? Are cases going up? Are cases coming down? Is their death rate up? Is their death rate down? By that time, do we have a vaccine? Do we have a treatment? So those are some of the policy positions I will be looking at before we advise. I don't know if the CMO wants to add any clinical details.
No, I mean, it's along the same line. So basically, if you look at how we went about our closures of the border, and we looked at the numbers that were occurring at one point in China, the fact that there was no vaccine, the fact that there was no specific treatment, we have to look at our actual relationship with that particular country in terms of the way transit occurs, whether there's a large number of people coming from that particular jurisdiction or a small number that we might be able to manage and follow. So all those factors play a role in determining if and when to open the borders to specific countries or to all countries. The containment within individual countries is most critical. The number of cases, active cases that they have, whether it's reducing, if they have no cases within a certain time frame, that all of those factors will be taken into consideration.
Thank you. CNC3.
Good morning, everyone. Chester Zambrano.
Morning, Chester.
Good morning.
Okay, so maybe the CMO could take this. So there are reports this morning that a security complex in Cedros is now under lockdown after Coast Guard officers rescued a boatload of Venezuelans from a sinking pirogue, and they were exhibiting flu-like symptoms. Can you say how these officers, I think 27 in total, are going to be dealt with, as well as the Venezuelans?
Okay, should I answer?
Minister.
Yeah.
So what I know about is there was an interception of 32 Venezuelan nationals, I believe, which is a matter for really national security, to be honest. The health component of it is really to do an assessment of those individuals to make sure that they have no acute illnesses while they're being held in Trinidad. The officers, having been in contact, if someone was deemed to have flu-like illness in that particular group or just by mere exposure without PPE, they would have to be quarantined, whether it is by the Defense Force or within one of our facilities. Over the next few days, we will make that decision. But if there was any level of exposure, they will be quarantined for the 14 days like anyone else.
Okay, CMO, I have a question for you online. Can you inquire if the ministry is considering using contact tracing mobile apps?
No, let me answer that. Because I answered this a week ago, and again, I have no problem seeing it again because different people listen on different days. The issue of mobile apps is being used in large countries with huge land masses. For example, Australia, England. We have two characteristics here that I have to get legal advice on. The legal advice is privacy rights, because this is happening in those same countries. Because for that app to work, let's say Chester Zambrano of CNC3, for that app to work, Chester, I'm just using you as an example, my friend. If Chester is COVID positive, he has to enter on his phone and give up his personal data. And that is how the app works. Then anybody else now, with the app, that phone is linked to Chester's phone. Question, does Chester, does Tobago Channel 5, does Richard want to put their medical status on a phone? So I have to get strong legal advice. I see Richard doing that. No, but this is serious. You have serious privacy issues, so the Attorney General will have to advise me. 2, Trinidad and Tobago has a small land mass. Do we need apps, or could we get by very well as we have been with the GIS system? So again, general rule, let's be careful what we import from outside to our own local circumstance. It is something I am looking at, but I have to understand the legal pitfalls. I could see this thing going to court if we decide to use it. It will go to court for violating people's constitutional rights to privacy, Section 4 and 5 of the Constitution. I could see that. You will have to have a bill in the Parliament, possibly debated, to allow for that. So serious legal consequences, but in the absence of an app, our GIS system has worked very well for us so far in a small landmass of Trinidad and Tobago. Thank you very much.
Thank you very much. Express.
Good morning, Camille Hunt, Express. Minister Dialsing, forgive me if this was addressed already, but yesterday during the PAHO weekly briefing, a PAHO official raised some concerns about how prepared Caribbean countries are to respond to hurricane-related emergencies while also dealing with COVID-19. And we know the hurricane season is almost here. They raised the point of shelters. If people have to go to shelters, that is not an ideal situation for physical distancing and so on. So how do we treat with that? And is the government updating its hurricane preparedness plans? You know, how prepared are we for the hurricane season in this environment of COVID-19? And I also wanted to find out with the community testing, Venezuelan migrants being tested in this initiative as well?
Okay, thank you very much. And again, never apologize for asking the question. It's my pleasure to answer it because different people listen on different days. Yes, so the issue of shelters, you may remember Ms. Patty Ann Williams was here a week before last. She is responsible for the disaster management coordination. And every year we do it, but this year COVID is a twist. So what they are doing is actually coming up with more shelters where you could have that social distancing. One of the papers that I spoke about as we are doing our post-mortem on our first wave is exactly that. 12 papers are being done, moving from COVID to the hurricane season. So we are quite aware of the challenges that we will face in the healthcare system, working together with ODPM, working together with the Ministry of Rural Development and Local Government. Those are the main agencies that do disaster management response. And we are working hand in hand with them to mount a shelter response considering COVID. So that is where we are with shelters, and that is what we are doing for the hurricane season as part of our heightened vigilance and heightened state of alertness. But it's an excellent question, and I want to give the population the assurance we are working with ODPM and Ministry of Rural Development and Local Government on it. Thank you very much.
And the community.
And the community.
So with regards to the community testing, there's a national protocol. Minister would have spoken to it already as it relates to treating with non-nationals versus nationals. Non-nationals will get everything that it relates to public health which includes vaccination, it includes testing for any infectious disease. So the answer to the question is yes. Anyone who is deemed migrant or non-national will be getting testing available through the community testing or any other form of testing that is required.
So let me just go into more policy positions. As Minister of Health, I took a note to the Cabinet in June of 2019, which is almost a year ago, to come up with a policy to treat with what levels of care and services migrants will get in Trinidad and Tobago. And that Cabinet-approved position of June 2019 spoke to all public health measures. What does that mean? It means anything to do with public health, infectious diseases like malaria, H1N1, they will get vaccinations. The children of migrants will get their full MME shots, polio, whooping cough, everything. And in the note, because remember in June 2019, COVID was not in the vocabulary of anybody in the world. The Cabinet note spoke to other infectious diseases. So the Cabinet note was very broad. That is how you write a note. It was a good note that now COVID will be captured under any other infectious diseases. So they can be tested and they will be treated for COVID. Any migrant, whether you're from Venezuela, Ghana, Jamaica, United States, anywhere. Thank you.
Thank you. Astronaut Health News.
When it's short, Astronaut Health News. Good morning, everyone.
Good morning.
There any, sorry, if a member of the public wants to assist the government in various aspects of online education, who can they contact? And are there any circumstances under which a community test of an individual, the results will have to be repeated?
Okay, so
a community test will have to be repeated.
Okay.
Are there any circumstances, and if so, what are they?
Let me just ask, you talk about online education. Is it in relation to health news?
Yes. There was a announcement that persons who have certain qualifications were invited to assist the government in terms of online education related to COVID-19 and having to not go back to school and
education. So that's a question for the Ministry of
so
Education.
what is the contact for that?
Okay, I'll try to get that information. I'll try to get that information for you. That will be in relation to the Ministry of Education, I guess. So I'll try to see if I can get it as soon as possible. Minister?
No. Yes.
CMO?
So in terms of your repeating, any test that we do as clinicians may have the potential that it requires repeating. For instance, if you do for the nasopharyngeal swab that we do, there may be some issue with transport, there may be some issue with the media that is used, something that happens along the whole chain of transfer from the facility to the lab. Maybe the sample size is not great enough in terms of the quantity of virus when they actually run the test. So any test that we do, there's a potential that it may need repeating. What is important is that we have the information of the persons that we take the sample from. In the event that the sample is not viable, we can contact them and have that test repeated. So that is done in every case.
Okay, thank you. Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. My question is for either the CMO or the Minister of Health, whoever you all decide will be most appropriate to answer. And I know you all would have touched on it a bit in the past. I want to know what is our protocol for any resurgence or any cropping up of cases during this period in which we are starting to phase in reopening our economy. I know you all would have spoken a bit in the past about when we reopen our borders and with mandatory quarantine and stuff, but I want to know what is the plan now that we have opened or started to phase in the reopening of the economy? Are we just going to go back a step if we see any cases come up? What are the parameters?
Rashad, before the CMO answers, could I ask you a question to do with the app? If you were COVID positive, would you put your status on an app? I'm just trying to find the same question that I was asked earlier. Would you put your COVID positive status on an app? I'm just trying to get an idea.
It depends. If it will help the public, I would.
So you would be. Great. That's good to know. Thank you.
Right. So the whole point of having a phased approach to reopening means that we are taking every step that we go forward from step 1, 2, 3, and all the rest. We are increasing the risk of spread because we are increasing the risk of movement of people. There's an assumption that if there's a hidden pocket somewhere that we're not seeing. So as you know, we almost day 25 now that we have no cases confirmed. So there's an assumption that there's little or no spread, and we can take the risk. So it is a matter of basically balancing risk and also balancing the mitigation measures, which we have spoken to in the document that gives guidelines to workplaces with the new normal. So mitigating the potential risk of spread. But to answer your question in terms of resurgence, resurgence can mean many things. So if we see resurgence, and I think even the Prime Minister has said, we may have to go a step backwards. Depending on the type of cases we see, the number of cases we see, if we do get a resurgence, we will have to determine how far backwards we need to go. If we hold at that particular point and don't go forward, or we actually need to revert to a previous phase. So that will be based on the types of cases you see coming up and the number of cases as well as other factors. Richard has one last follow-up.
You have a follow-up?
Yeah.
Go ahead.
Yeah. Hi, you hear me, right?
Yeah. Yeah.
Okay, Siebo, so I know you stated there just now that it depends on the type of cases that you see cropping up. So would you be willing to say at what type would it be that you would say we need to go back? Is it when we start seeing clusters, or if it is that we start seeing community transmission?
Right. So as we have said before, one case can potentially create a series of infections that may be in the thousands. Depends on the contact. So let us take an example. So we have a person that we find that is positive. We find them on day 1 of symptoms, right? So you do a test. When they first started to exhibit symptoms, they haven't gone to work. They're part of the group that stays at home. They haven't mingled with anyone except their family. That is considered a low-risk person, right? So we pick them up very early in the disease, so they would have a limited access. Their primary contacts would be 3 or 4. If so many, they may have gone to some other places in between. So, but the important part is that very early on the spread of disease, so they pick them up early on day 1. There's another if you use another example where you have the same patient, they pick up a patient, but they pick them up on day 10 of symptoms, right? So they exhibit symptoms for 10 days, and now this person is part of the workforce that would have gone to a manufacturing plant, for instance. They went to work during the time that they were ill, so we didn't listen to the stay at home when you're ill part. There's some clustering and congregation in that workplace where there may be 1,000 people in that particular entity. That creates a significant risk of spread to 1,000+ people. So it depends on the kinds of cases we get, where they at in the clinical symptomatology, the number of primary, secondary, and tertiary potential persons for spread. So there are a number of factors. We really have to wait and see and hope that the numbers stay as low as they are now and move forward very slowly in a phased approach to prevent any alarming spikes.
Thank you very much. Before I call the next person, Gwyneth, you asked about the information for the Ministry of Education. The email address is info@moe.gov.tt. info@moe.gov.tt. So you can send information or queries to them. I-95.5, one question, please.
Thank you very much, Minister Dialsing. I don't know if you could speak to this, but we're getting concerns from persons with respect to e-learning and devices. Some persons' devices may be in need of repair. Some may need to get new devices. And the places that sell and repair such devices are still closed. So I don't know if there's anything you might want to speak to that particular group about, and if you can give us the updated community testing numbers for Tobago.
Okay. So your first question speaks to...
Actually, Minister, I told him one question. Eh?
Okay, so...
One question. Choose which question you'd like to get answered, please.
I'll leave it up to you.
Let me answer the first one because that's important. Look, when we took the decision to start reopening on Monday the 11th, we said you cannot flip a switch and open the whole economy at the same time. Everyone will come to you. Booksellers will come to you. Construction will come to you. Ice cream parlors will come to you. If we listen and open the economy at the same time, and the CMO just answered a question, you are going to slingshot right back to where you came from. This phased reopening is to save the same lives of the persons who own the cell phone shops, the bookstores, the computer stores. We want those people to have a livelihood and a life. First of all, we want them to have a life so that they can get back to their livelihood in a phase basis. So we are using the dimmer approach. There are some bulbs, you put a switch on off, you go from darkness to total light. We are using the dimmer approach where you gradually turn up the heat, turn up the light, see what cases you get. As the CMO said, it takes one case in a factory to infect 100 people. Do we want that? Do we want to scramble back to 2 weeks ago where there was a total lockdown? So we understand, we empathize, we appreciate the hardships. However, if we act recklessly and try to be popular with every single sector of the society, we become popular today, you know. We'll be very popular. We could walk down the street as a minister and say, hey, Ray, good job, minister, you open up. But what happens in 2 weeks? When you get a cascade of cases, your hospital system is overwhelmed, coffins are lining up by the hundreds, you can't dig enough holes to bury people, the crematoriums are filled. That is our future if we don't act responsibly. And these are very hard decisions to make, but we are acting in the best interest of 1.4 million people to do things gradually, to take some measured risk instead of being reckless. There's a difference between being measured in risk-taking versus being totally reckless. We are going to be measured as to what level of risk we think we can take, but we are not going to be reckless. I hope the population understands the difference as we try to save lives, to make sure everybody has a livelihood to go back to in a phase basis. I hope that answers your question, my friend.
98.1.
Morning again. Thank you. Minister Dayal Singh or Dr. Parsram, you can take this one. My concern is with asthmatic patients and those who are category persons who would have to use ever so often Ventolin. And, and we have the situation as well of the wearing of masks. What are the guidelines or what can you advise for those persons who are placed with two scenarios? One, they may have an attack and, they may have to use that and also in having to be kept covered with the use of their face masks.
Okay, so as I said before, especially with persons that have chronic diseases like asthma, COPD, it becomes difficult to wear masks. You need to seek your advice of your medical practitioner before you wear masks to get they need to do individual examinations, and there's not a one-size-fits-all for someone that has COPD or asthma. There are different levels of asthma. So somebody may have very mild disease, get an attack once a month. They are still asthmatic, right? They may be able to wear the mask for certain periods of time. There's another type of asthmatic who gets an attack twice a day. So it depends on the phase that you are with your particular disease, and the only person that can work through that with you is your personal physician. So my advice would be, before wearing and taking any risk, that you seek the advice from your practitioner and have that discussion one-on-one with that person.
Astronaut Health. One question.
Right. Good morning again. Gwyneth Stewart, Astronaut Health News.
Morning.
A loss of taste or smell has been reported as a fairly recent symptom of COVID-19. Is it really a symptom, and are we making members of the public aware of this? and other symptoms that they need to experience to come forward for community testing?
Okay, so again, thank you for the question, and that was spoken about on this platform 2 weeks ago, 3 weeks ago, for the new symptomology that post the initial wave, researchers around the world were coming across with this new symptomology of loss of taste and loss of smell. It is something we are aware of. It forms part of our research project now. We have sent it out to all the A&Es to start to be aware of it, and now the CMO could take over from a clinical perspective.
So as Minister said, we have sensitized our healthcare practitioners in the first instance. We have sensitized the persons that are taking the calls as well. And I think we have used this platform and some other media platforms to at least let the public know that those are new symptoms that have been coming forward.
Thank you very much. We are out of time, actually. We've come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. The decisions of the government are guided by our public health officials, whose advice has protected Trinidad and Tobago so far from the ravages of this pandemic. And I would like to take this opportunity to thank the Minister of Health, the Chief Medical Officer, and members of the health fraternity for their dedicated service to the people of Trinidad and Tobago. Today, you might not be where you want to be, but we are assuring you that your time will come to return to your place of work, places of worship, gyms, and even linemen. The reopening of the country will continue on a phased basis once there is no movement in the infection rates. Please be patient and know that your time will come soon, as more people move around and we enter our public spaces. Remember, COVID-19 remains a threat to our health. Let us do our part to ensure that we do not create the environment this virus needs to thrive. Your discipline, patience, and adherence to public health guidelines are important assets in this fight against COVID-19. Remember, we are all in this together. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.